Good evening, and welcome to the 17th Annual Legislative Town Hall on Intellectual, Developmental, and Other Disabilities. I am Christina Botero, Guardianship Coordinator with the ARC Pikes Peak region. Before we start the Town Hall, please take a moment of silence to honor Parole Officer Sandoval and the victims in the deadly attacks in Israel. Thank you. It is truly a privilege to be part of the extraordinary planning committee responsible for sharing this exercise in democracy. In the words of Margaret Mead, never doubt that a small group of thoughtful citizens can change the world. Indeed, it is the only thing that ever has. Over the last 17 years, our small group of thoughtful citizens have collectively impacted change in our state for people with intellectual, developmental, and other disabilities as a direct result of this town hall. If this is your first town hall or your 17th, thank you for your contributions in changing the world. In addition to the people participating in the auditorium, we have more than 100 people in our virtual audience. The event would not be possible without the incredible staff here at El Paso County Centennial Hall. Nancy, Blake, and the channel and audiovisual team, Ingrid, Jenny, Brandy, David, the facilities and security departments, and the many others behind the scenes. We also express our gratitude for access to the parking garage, right? Yay. I would also like to thank Melanie and Amy with Sign Language Connection for providing sign language interpretation. For those participating through Teams, please reach out for technical assistance through the chat function to access closed captioning and interpreter services. An agenda, list of panelists, and ground rules were attached to the email you received with the link. For those in the auditorium, agenda and ground rules were available as you checked in with Tammy, Ginger, and Ryan. We ask that you please review the ground rules and adhere to them. This year, the Town Hall will be a Q&A format. Participants will have the opportunity to come down to the podium or raise your hand for the roving mic or write your question on a note card to be passed along to our moderator. Bruce and Brandy are in the audience to assist with the mic and note cards. To ensure equal access, we ask you to limit yourself to one question. If time allows, you will have an opportunity to ask additional questions. For those participating virtually, you can type your questions into the chat feature. The chat will be monitored and questions will be passed along to our moderator. This evening is for our panelists to hear from you. Our moderator will help direct your question to the appropriate panelist. Our timekeepers this evening are Jen with visual aids and Ginger with verbal cues. A yellow card and a verbal cue will be given when 30 seconds remain. A red card and verbal cue will alert the speaker that their time is up. Thank you to our amazing volunteers and planning committee. And finally, I would like to express my sincerest gratitude to Julie White and Tammy Ingram for your hard work and dedication to making today's event possible. It is now my pleasure to hand the mic off to Wilfred Romero.
Good evening and welcome. My name is Wilfred Romero. I'm the Executive Director of the ARC Pikes Peak region. For those that aren't familiar with the ARC is part of 700 chapters spread out throughout the United States and part of the largest civil rights organization for individuals with intellectual and developmental disabilities. Here in the Pikes Peak region, we are able to do our work through the proceeds and the donations and shopping at the ARC thrift stores, so remember to do that. So that's my 30-second commercial there. Tonight, I have the privilege of recognizing this year's presenting sponsor. That's Colorado Community Health Alliance, CCHA. We appreciate your continued support of the Legislative Town Hall. Amy Yutzi, Emily Kimmich, and Megan Bilsbach are here this evening representing CCHA. If you'll stand up. Here. Well, welcome and thank you. And we want to give a big thank you to the Picnic Basket for providing the refreshments for today's reception. We have several special guests in attendance with us tonight, so if you would, please stand as I introduce you in no particular order. Robert Hernandez, City of Colorado Springs, Office of Accessibility. Rose McCormick, City of Fountain, Public Works, Assistant and ADA Transit Coordinator. Chelsea Gondek, Downtown Partnership. Daniel Somerville, City of Colorado Springs, Cultural and Community Outreach Programs Manager. That's a big title there. Longino Gonzalez Jr. from the El Paso County Commissioners, District 4. Is in the audience with us. Paul Morrow, City of Colorado Springs, Housing and Community Vitality Department. Also in the audience with us is Senator Tony Exum, District 11. Cami Bremer, El Paso County Commissioner, Chair, District 5. She had a scheduling conflict this evening, but she did attend the reception, so I hope you had an opportunity to visit with her and ask questions if you had any. So again, thank you for joining us to learn about the needs of people who are often overlooked and underserved in our community. The planning for this event starts almost immediately following the town hall each year. This event would not happen without the generosity and sponsorship and dedication from our planning committee members, agencies, and board of directors. Please stand to be recognized as I call your agency name. Cheyenne Village, Dungarvin, the Resource Exchange, the ARC Pikes Peak Region, Again, your time and dedication are evident in the true nature of the collaboration we see tonight. Thank you for helping to make the Pikes Peak region accessible and inclusive for all of our community members. I now welcome Colleen Head Batchelor, CEO of the Resource Exchange.
Thank you. Thank you all for being here tonight, and thank you all for coming, and those online as well. We're excited to have this event come back to kind of an open mic night, so we're glad everyone's here. The Resource Exchange has been advocating for independence and inclusion of people with disabilities and young children with delays and disabilities since 1964. We're celebrating our 60th anniversary next year. We have made a commitment that was initiated by a group of families really wanting to ensure that their children and family members remained in their home and in their community, and that the community would come together to support their needs. Putting people first is how we believe we try to do this. Tonight, you're going to hear about many of these needs and how our community can come and should come together to address them. This important annual event amplifies your voice to our elected officials, helping to create understanding, forge partnerships, and identify solutions. It also provides a platform for you to hear and learn from our elected officials about the many efforts already happening or planned to occur. This forum helps shape our legislative priorities in pursuit of our mission of empowering people, strengthening families, and building inclusive communities. Ed Bowditch is our moderator this evening. Ed has a master's degree in public policy from Harvard University and an undergraduate degree from Colorado College in history and political science. His professional experience includes having spent 3 years on staff at the Legislative Council, 7 years as senior staff to the Joint Budget Committee, and 1 year as Deputy Director of the Governor's Office of State Planning and Budgeting. He possesses an unparalleled familiarity with the state budget process. We're proud to maintain a professional paid relationship with Ed as our TRE lobbyist, so our voice is heard at the state capitol on behalf of the people we serve. Thank you all for attending this evening, and please help me welcome Ed.
Hey, it's great to be here. I haven't been here for all 17, but each one has been a little different. Some years we've scheduled these during snowstorms. Some years we scheduled them, I think one year during a Broncos game. This year we almost nailed it. We almost got the eclipse, but we're a few days earlier than the eclipse. But let's start up. We all know the rules. I'm here to moderate to make sure we keep the panelists from taking too much time on each answer and making sure a lot of people get a chance to answer questions. Would anybody like to kick off any questions that we have? I'll start. Well, we have one. I was going to start one, but let's start back in the close to the top. While we're waiting, I will raise something that came up a year ago. There was a concern, I remember, about all of the scooters and bicycles, the rental scooters and rental bikes. I've never been on one. People tend to leave these in the middle of sidewalks sometimes. And anybody with any sort of mobility issues must navigate around them. And can the city do something working with the companies to try and address those and make sure they're placed not in a public, throughway? I remember that came up a year ago. So I don't know if anybody, I'll just throw this one out to start off. If anybody has any other thoughts on that, if it's still a problem, if it's still a concern, seeing a few heads nod, would anybody, probably more at the local level, like to address this to start off? Yes,
I'll
Sally.
go ahead. Hi, I'm Sally Clark. I'm representing Mayor Mobilati in the city of Colorado Springs. Just if you do see them, you can report them through the GoCOS app on the city's website, which is coloradosprings.gov. And that way someone can come and pick them up. So that is certainly important that there's accessibility on those sidewalks. So we appreciate that.
Okay. Thank you, Sally. Representative Ehill.
Hi, Steffi Hill, HD16. There are some ways as well that those companies can, I don't know who compels them to do that, whether we would do that at the state or the local level. There are some ways to compel those companies to have stricter standards for their own user base, whether that's, when you take the photo, it needs to be clear that it's not blocking the sidewalk or that you get deactivated from it. If you abuse that too many times, there are things that they could do as well.
Okay.
So we could hold them to.
Thank you. And the first question tonight might be best for Haley Gleason, who is representing here from the State Department of Healthcare Policy and Financing. How can we make Medicaid access and recertification easier for people with IDD? The forms are confusing, processing times are slow, and it is difficult to talk to workers to get help.
Okay, how about that?
There we go.
Hard to be the first one. All right. I really appreciate that question and, understand that we hear from a lot of our members that whether you're initially applying for Medicaid or you're going through the process of recertifying, it can be really complicated. And, whether it be the forms, the process, the timeline. There's a lot of people you have to talk to. You have to go to a lot of different places. So I hear you. I hear that is a challenge. And there are several things we are trying to do. I would say it's not a one-day fix. We have been working on this for a while, but we'll continue to work on it until we get that streamlined. Right now, we are actively working on looking at all of our member and family communication and forms to make sure that they're more understandable, because we know that when it's written in bureaucratic language, that is not helpful for you. So we are actively working on that. We're also looking at streamlined eligibility, which will speed up that process. Currently with the PHE unwind, we know that there's some particular challenges and delays. So we have instituted a 60-day additional time to go through the process for all of our long-term care members. So that's something that we've instituted. We started September 1st. So right now we are giving more times to make sure that everyone can get through that process. And we also have an escalation process. So if you are experiencing any challenges right now, please let me know. I will stay around afterwards, but we have a process where we can get those escalated really quickly so that you can get your issues addressed right now. So we know it's a bigger problem and we're working on those issues too, but I just want everyone to be aware that related to the PHE unwind, we have some specific strategies that we're implementing currently. So if that is you, please come talk to me afterwards and I'll help you get that information.
Thank you. And I'll get to you in just a minute, Mayor. We will be ending at 7:45 so that we can have exactly those types of conversations. And before the mayor goes, I want to say this will likely be the last year that I'm invited to be the moderator because I've forgotten to introduce everybody. So my apologies. We do have a city council member from Colorado Springs, Michelle Tellerico, and then 4 state representatives, Mary Bradfield, Regina English, Mark Snyder, and Stephanie Vigil. Commissioner Stan Vanderwerf from El Paso County, Yolanda Avila, city council member for Colorado Springs, Sally Clark, former commissioner, now works for the city, Mayor Sharon Thompson from the city of Fountain, Councilmember Bell, the trustee from Palmer Lake. Sorry about that, Palmer Lake. And as you just heard from Haley Gleason from the State Department of Healthcare Policy and Financing. Mayor.
It's more of a procedural question.
Oh, procedural.
There was going to be somebody with cards to hold up, so we
Yes.
kind of knew, and I don't know where that person is. Okay,
Yes.
thank you.
Okay.
All right.
Thank you for the procedural question. Representative Snyder. Yeah.
Thank you, Ed. Yeah, Mark Snyder, House District 18, and thank you, Haley, for that great explanation. It's a very challenging time. As you know, we've been going through the Medicaid rolls. We're actually eliminating some folks from those rolls or having to reapply. That makes it especially challenging for not only the people that are facing having their Medicaid removed, but also for the state trying to make sure we get it right. And so there's an extra burden there. But I just wanted to point out that, we have done some things in the Medicare space. We eliminated the mandatory copay requirement for Medicaid patients accessing pharmacy and outpatient services. We also added an additional $14 million or so to the primary care fund program with HICBUF, where Haley comes from, which, and we eliminated the annual $1,500 cap on adult dental benefits. So I know that doesn't directly answer the question about how difficult it is to navigate through the system, but we are aware of some of the challenges people have and are trying to address those.
Yeah. Yes, Commissioner.
Yes, thank you. And just kind of a quick observation from me as well regarding this topic. And again, I'm Stan Vanderwerf, El Paso County Commissioner. I just think it's important for every public agency, whether that's a county, a city, the federal government, the state government, to be constantly working on trying to make their procedures and processes more efficient and easier to understand. I'm a disabled veteran, so I deal with the Veterans Administration, and I won't get into the details, but it took me 9 months a few years ago to get a medical procedure because the state policies and the federal policies and the company policies weren't mixing well together, and it was just ridiculous, quite frankly. So we should always be looking at that. So that actually fits well into this conversation for people with disabilities, but it's a broader question about just every public agency needs to be working on trying to make their processes that their citizens interact with efficient and easy to use, and do it all the time. Keep trying to improve all the time.
Well said. Next question. Yes, we have a question here. You can, here comes the microphone.
Yes, everybody. My name is Alfie. I guess one of my questions is, it might be a two-part question.
All right.
But if so, what can we actually, kind of programs can we actually get homeless, disabled people in? And if so, who might be responsible for whatever programs there might be available to help them?
Probably best question for one of the city representatives, I would guess. I don't think there's as much interaction with homeless initiatives at the state level. There's some through the department. It's more providing grants, but the actual provision of services, I think, is more on the city level. So I don't know if one of the council members or Madam Mayor or the trustee wants to take that, or Commissioner Vanderwerf.
Yes, thank you. So we do have a lot of programs that try to help in that regard, and they kind of support specialized environments. Like, for example, we have a Veteran Services Office. But actually, I want to make a point that one of the best ways to help the homeless population, help them get to services and so forth, is our nonprofit community. And we have a lot of that here in El Paso County and the city of Colorado Springs, and they do a lot of work. So sometimes it's a difficult situation because the homeless person might not be willing to accept services. But if they're willing to go to a shelter, there's all kinds of potential opportunities there, or actually just get involved in one of the nonprofits. And I think we actually have something like 50 nonprofits here in El Paso County that work exactly in that space. They have a lot of resources that can help people get connected to services. So if the homeless is willing to accept that, then that's a way for them to address that. And that doesn't entirely answer your question, I think, but I did want to make the point about the nonprofits in the community that play a great role in that as well. So it's not just the city and the county, it's also the nonprofits that play a great role.
Yeah. I know, yes, go ahead.
Shauna Ball, town of Palmer Lake. Palmer Lake, like so many other communities that are outside of Colorado Springs city limit, but still within El Paso County, there's several resources that we recommend you reach out to. Your local police department can help you get in touch with a lot of the nonprofits that were just talked about. We also recommend reaching out to profits like the Resource Exchange, Department of Human Services, things like that. You can always get in touch with, like I said, your police department, department, also your town board of trustees, or whatever, government entity that's put in place for those outlyings like Calhan, places that are kind of out in the way out of city limits. Those are the resources that we recommend that you tap into, because we, even though we're outside of Colorado Springs, we also tap into all of these nonprofit organizations.
Kelly?
Don't forget about your local VFWs and American Legions that many of you have the right to belong to. I know ours gave a report just Tuesday night at council that they had housed in the last couple of months 7 families for 30 days to get them off the streets and give them a chance to rest and help them get some services in place. So that's another one I think a lot of people forget about sometimes. Yes. And those are pretty easy to get into.
The final word on this, Haley?
Sure. I just wanted to mention a pilot program that we are doing right now within Medicaid, funded with some stimulus fund dollars. It's a wraparound services and supports program for people who are homeless, and the program is really looking to, it's a housing first model, looking to provide all of the services to help them be successful once they have that housing, and provide some peer supports as well. That pilot is underway now, and we hope to offer those services to about 400 people, but also collect some data to show the efficacy of the program, in hopes that we could bundle these services in the future and have them paid for through Medicaid. So, a challenge for Medicaid is we can't pay for room and board, but we can pay for everything else. And so if we can figure out a way to effectively serve people and wrap around them so that they can have those services for up to a year, then we can hopefully keep them housed and get them the supports that they need.
Okay, thank you, everybody. Next question. One back here. The microphone is coming.
Oh, cool. Thank you. Good evening, everyone. My name is Michelle Williers. I'm the Executive Director of Peak Parent Center. We're the Parent Training Information Center for the state of Colorado, funded through the Office of Special Education Programs, the Department of Ed. And, we all know about that cliff, right? You graduate from high school, you turn 18. When we have students in the Individuals with Disabilities Act that can go through the age of 21, what we're finding are our calls at our Parent Center are surging for the post-21-year-olds that have significant support needs with intellectual developmental disabilities, and getting access and supports within the services that are funded through their Medicaid dollars and their waiver supports. And my question for you all is, what steps are you taking to address the service gaps for these young adults with disabilities who are above the age of 21 and they don't have the IDEA to support them anymore?
So what steps are the state and local governments taking as individuals age out of the IDEA programs at age 21? They may or may not immediately get services at the Resource Exchange or one of the other partners here. But what can we do? Because I have heard that in other parts of the state as well, and from parents, that people hit 21 and they're kind of put on a waiting list sometimes, or other things. Would anybody like to address that? Representative Snyder.
As a parent who lives in that world,
yes.
I had a child who we moved to Colorado and he had no services.
A little closer to the microphone.
When we moved to Colorado, my developmentally disabled son was 13, and we went on the wait list, and we had no services until he was over 21. So I've lived in that world. I walked in that world. I drive in that world every day. We need more state funding. We need to reduce the wait list. And I believe years and years ago, that was a goal of former state representative Lois Landgraf. She worked to get the wait list developed, and the wait list is still out there, and we need more funding for it. And when the programs are available, we need more funding for rides. We need to be able to get them there. We need to transport them to and from. We need to figure out a cheaper way to get rides, maybe a reimbursement for parents to, help us out with the gas, right? I bought 15,000 extra miles on my lease car because I knew that I was going to put that mileage on very easily within 2 years, just toting my son back and forth to programs. And that's in addition to the bus rides that he receives from some of the services around. So we need more funding, we need more money, and that comes from the state. We need to figure out how to backfill these programs better.
I think that's a That's a very clear answer. Yes. Anybody else, Commissioner?
Yes, thank you. Of course, many of you do know that we have the Department of Human Services in the county that administers a lot of these federal programs on behalf of the citizens here in El Paso. So there's kind of a lot of a state of play in all of these questions to one degree or another in the county. Now, to the specific question, I know that's a concern of ours, and to that specific question, I'm not sure I have a great answer for you, but I do know in the arena of foster care, that is another area where there's been a bunch of challenges. And our DHS office has tried very hard to take on that challenge. And it's, you get a limited amount of success, but you do make progress, and that's really good. There's other things that I think are really important to pay attention to on this issue, because one thing that is great that I consider is important for the dignity of the individual involved is to help them get a job. So we have the Pikes Peak Workforce Center that we try very hard to get everybody placed, because when you can, no matter what disability you may have or whatever the issue is, if we can get that person to a job, then they're earning their own resources to take care of themselves. So there's a lot of connection to that, and I think that's really important. We put a lot of time and effort into that. So Cami Bremer and I sit on the board for the Pikes Peak Workforce Center, and that's one of the things we pay a lot of attention to, is trying to take care of people that sometimes get left out.
Yeah.
So that's not a perfect answer to the question, but that's certainly a part of it.
Yeah. All right. Thank you. I'll ask the next question from the notes that came in. And this is an issue, behavioral health is an issue that is probably, that and housing, I'd say, are the number one issues that the legislators talk about, hear about, and really want to focus on in many ways. Are there any plans to address the disconnect between crisis services and people with disabilities? Many times when someone with disabilities is having a mental health crisis, they are turned away from services because counselors don't know how to work with the disability community. Yes, Haley. Then you. We can start with you, Representative Bradfield.
Thank you. Thank you for the question. And thank you. I do want to thank everyone for being here tonight. Yeah. That question of disabled in a crisis situation is being looked at, being addressed, and the best idea, and we would welcome more, is very systematic education for all people that would be coming counter with the individual in a crisis, to know better how to handle the situation, also to be better informed of the services that are available for that person. But the problem can be solved with a two-prong approach. One is education, so that people know what to do, where to go. And number two is we need more qualified behavioral health providers. And, we have a lot of people who want and need services, but there's no place to go. So let's start someplace. And if we can start with education with the people that we have, that will probably help bring more people in. And I appreciate that question. Thank you.
Thank you. Yes, Representative Hill.
Thanks, Ed. I'll just share one thing I'm a little bit closer to because I'm on the task force. We have a disproportionate discipline in schools task force that we're working on this summer, and I know this is more in the school realm, but we do see a lot of punitive action taken against individuals disproportionately, and it starts in school very frequently. So that seems like a good place to start with that. And I will say that one thing that's high on everyone's mind on that task force is just the varied ways that someone can be targeted for more severe discipline. Whether it's because of racial or ethnic identity or disability or anything else about them that might cause that to occur. So there are some solutions coming. They're a little bit slow, and I know that the Department of Education is already doing some internal research. So this task force will complement that in some sort of productive way, and hopefully we can have a bill ready by next year that will address some of that head on.
Okay. Let's go to.
Oh, if I could add really quick, we have a couple of programs underway, and we absolutely agree that this is a problem. So we are currently working on developing a cultural competency training for behavioral health providers on how to work with individuals with disabilities. And so we are really excited about that training. I think to mention that education is key here. We need to educate our behavioral health providers and make sure that they can serve people with disabilities. So that's one piece. The other piece is that we just in July rolled out a new service, or we're a mobile crisis service under Medicaid, where instead of having a police response, we have a behavioral health response when there's a crisis, so that we can help support people where they are instead of sending law enforcement, which may not be the right approach. So we have a couple things going on here. We realize that this is a real challenge.
Palmer Lake, in connection with that, Palmer Lake is applying for grants so that our police department or public safety response, that's EMS, the fire department, police department, can essentially hire somebody who will be on call or available 24/7 for crisis intervention, so that it's not being put in the hands of those who are, less trained. But at the same time, we're getting our public safety providers better trained in how to deal with those situations. So, and the financing is difficult. It's a hard grant to get, and there's only so much money available, but they are trying. And I think if we can at least set the standard or get started with that, maybe surrounding communities will fall in line with that, or we can do like a multi-community grant that will provide that for an entire area. For instance, for us, it would be the Tri-Lakes area, serving Monument, Palmer Lake, Woodmore areas, and maybe even Larkspur going into Douglas County. So,
Representative English.
Good evening. I'm Dr. Regina English. Thank you all for being here tonight. I represent House District 17, Southeast Corridor of Colorado Springs. I also serve for the Oversight Committee for the state. I serve on the treatment of persons with behavioral health disorders in the criminal and juvenile justice system. And I have a Senate bill right here in front of me, and the state is definitely building on and expanding on the work that has been done in the behavioral health space. And this is Senate Bill 21-137, the Behavioral Health Recovery Act. And not to read the whole entire thing, but I will just share that this bill seeks to rectify these issues by investing $114 million in various behavioral health grant programs to assist providers, nonprofits, and local governments address substance abuse, maternal and child health, and other behavioral health prevention and treatment programs around the state. And it also creates the Behavioral and Mental Health Cash Fund to be used in the future for transformational investments in addressing the state's mental health and substance use disorder crisis. And I myself will be working on some particular legislation that's coming up this session. I won't go into it now because it's just, it's not ready for me to go into it without being able to answer your questions adequately. But to learn more about me and my values and my priorities, you can go to reginaenglish.org. Thank you.
Thank you. The questions here are piling up, so I'm going to try and move through them pretty quickly. Currently, there are over 3,000, thank you. There are over 3,000 IDD adults on the DD waiver housing wait list. Mayor Thompson identified a key issue being a lack of funding by the state. My question, is there any support or will in the Colorado legislature to reprioritize spending to fund this wait list? Now, just a little bit of historical perspective. 15 years ago, there were a lot more people on the waiting list, and we had a variety of wait lists. The state has done, in my perspective, a good job of addressing some of those things. Now, if you're still on a waiting list, none of that means much. And I know Representative Landgraf the power of one individual can come to the legislature and raise this issue and get a lot done. When she arrived, she would ask, what's the number of people on the waiting list? And depending on the day you asked, you got a different number. And she passed a law saying the department shall identify the number and report that to the legislature each year. So at least we're using consistent data. But what is it? Is this a priority? I mean, the legislature is about addressing priorities, and we have a lot of needs in the state. But obviously, from what someone says, how can we make this into a top priority to continue to buy down the wait list? Representative Vigil.
I'll take a stab at this. This is the second item already. What are we? We're about halfway through the program today. This is the second item where we've just said we just need more funding. We just need more funding for it. And frequently we agree. And our issue with the legislature is that we not only can we not raise any taxes, even if that's what constituents have asked of us, but even if we spend, or a certain amount of revenue is generated, we still can't use it until the voters are consulted. So it's something for us all to keep in mind when we see ballot issues that say, without raising taxes, shall the state retain this, retain these funds and use them for things that we have wanted to prioritize, or do we want to cut a check back to people? So it's just something to consider. I think there are a lot of things we could prioritize, and this can certainly be one of them, but we do have to have enough funds to work with.
Representative Snyder.
Thank you. In the last couple of years, we've committed some $500 million into affordable housing, realizing the crisis that we're facing here in Colorado. But I can't, right off the top of my head, think of how much, if any, of that money has gone to the specific disability community in the wait list. So I hear the call for more funding. I think sometimes it's lack of the political will to direct that funding to where the need is the greatest. So out of $500 million, we should be able to do some work. And to piggyback on something that Commissioner Vanderwolf said earlier, we really rely on our nonprofit communities to develop a lot of the housing we have. Here in El Paso County, I know of 3 organizations right off the top of my head that are building 50 units for seniors, for homeless youth, and veterans. And those are actively going on now. We need to partner with those organizations and direct our funding to where it can be of the greatest value. And that's something I'm not aware that we're doing right now.
I'm going to keep moving us along. I see you, Mayor Thompson. Sorry, I'm going to keep moving us along. Now a question for the city. We have a ballot question this fall about funding for a new police academy in Colorado Springs. How will the academy training be changed to address police officer awareness for appropriately handling citizens in mental health crises or who are developmentally disabled?
So this is Sally Clark, and as a staff person, I can't take a position on this particular issue, although we have several city council members sitting here who could maybe address some of those questions. The police academy is a priority for the mayor, and that question will be put to the voters, and I'll pass it on to, I think, Councilwoman Avila.
Councilwoman Avila.
Thank you, Ed. Thank you all for that question. So this is on the ballot, and it's specifically to enhance training. The police officers themselves have asked for more training. We had there was a report out by Transparency Matters, and that was addressing some of the issues that are happening with our police force. We've never met the goal of having enough police officers, and this is why this training center is on the ballot to start the ball rolling. It's just less than $5 million. It'll probably take anywhere between 20 and 40 million. But the main training is to work on de-escalation, on use of force, on working in communities, and those are the things that we're looking at for this new academy. It's very important to the mayor and a lot of the city council. So I think that will be a key force. And there used to be a committee by the police chief, his name for the police chief before Pete Carey, Pete Carey. And he used to meet with all the community, and there'd be people with disabilities, hearing issues, and of all races. And we had those conversations, and I suspect that that's will take place on a very high priority level. Do you have anything else to add, Michelle?
I would add that I agree with my fellow council member Yolanda. I had the ability to tour our current police academy with our president of council and the police chief about a month ago. And I can say that for exactly the reasons that you just brought up and that you did, Yolanda, in terms of de-escalation and really meeting the needs of having our officers be trained to more specialize in and or be knowledgeable about people with disabilities and people with mental health challenges, whether that be a crisis or not. This current center just is truly not big enough to handle all of the scenarios that our police need to be trained with. So we will wait anxiously to see what happens with that ballot, but I do think that that will be a priority. I know that that is something that's been talked about by the police chief, specifically to your point.
Representative Bradfield.
Thank you. I am not a resident of Colorado Springs, but I do believe you have some of your police units that have a behavioral mental health person that goes out with them, and they are there to help the police officers bring the situation back under control, and are often really, truly the saviors of somebody having a bad day, a really bad day. So I think we need to look at not only expanding things like programs like this, because it is proving to be very beneficial.
Commissioner Vanderwerf, thank you. Representative Bradfield.
Yes, and I was wanting to talk about the Behavioral Health Connect units as well. This is what Representative Bradfield just mentioned. So we actually started this program in 2018 based on a funding from the state. So thanks to the legislators for starting this. It uses a co-responder model that the representative mentioned. And what this means is a law enforcement officer in a patrol car travels with a licensed behavioral health clinician, and the two of them respond to an event where there's some kind of a crisis. These have been fabulously successful. It's in the high 90% range of de-escalation that prevents incarceration and gets the individual that's suffering through a distressed environment, whatever that is, to services, because that clinician knows about what those services are. This has been really, really successful, and it's starting to spread across the state. It's starting to get used more broadly. So I believe those clinicians do have some disability training, but I would just mention that might be an interesting thing to investigate to see how much disability training they get. And if it isn't considered to be sufficient, that might be a very interesting piece of a program to make sure those clinicians have that kind of background. And I think Councilwoman Yolanda Avila wanted to make a comment as well.
Councilwoman, for the last word on this one, but go ahead.
Oh,
yeah.
Because I was thinking this was about the training center, but I just wanted to say we have a LETAC, Law Enforcement Transparency and Advisory Group. So they recommended another CRT, crisis response team, with the fire department and paramedics to work on these issues when we get these calls, persons suffering from mental distress. And so we added another CRT team, and we're looking now to make sure that those don't come from just grants, because the grants aren't reliable, but that we actually fund those in our budget. So I just wanted to bring that up.
Okay. We have three, thank you. Thanks to everybody for their perspective on that. We have three questions, and all of these may go to Ms. Gleason. These are more specific Medicaid questions. I'll read them all together. Is there any discussion about increasing the amount of money a person can make or save without losing Medicaid? We have income caps on long-term care, Medicaid, and assets and life insurance policy. When was the last time this was looked at for an increase? And then a broader question, we discuss a lot about providing physical services, but we do not often discuss financial independence for clients. So we'll start off with you. Sorry to throw three at you at once, but.
Thank you. I know this is an issue that we hear about frequently. One area that we have invested in recently and made some changes to is our Medicaid buy-in program, which does allow people to work and receive an income while also being on Medicaid and gaining access to services. So we recently made some changes to that program, and we see that as invaluable. That's really wonderful to encourage people to work and give them that independence, but also still get the services that they need. So we really don't want to have to see people cut off from services. So that's what we've been focused on most recently. I would say that increasing income caps and things like that, it's always in the back of our mind. We would love to do things like that. It's just, the capacity of the system to serve individuals with disabilities. We need to make sure that the system is ready for something like that, and we need to make sure that we've got the funding to support it. So, absolutely hear you, and we are trying to find ways to encourage and allow people to continue to make an income, get those services. The other area is supported employment. We are doing quite a bit around supported employment as well, again, around encouraging and allowing people to work while also getting the supports that they need. So we're trying to find ways to tackle the challenge how we can at this moment, but absolutely hear you that's something that is always in the back of our minds.
I know we had from a town hall event maybe about 10 years ago. There was a question about, I want to work more, but I'll lose my Medicaid coverage. There was a bill that was passed directing the Department of Healthcare Policy and Financing to look into a Medicaid buy-in program. Those are very complicated, and you have to get approval from the federal government. I know they talked about that. Going further back, Representative Larry Liston, he was then in the House, then a very young Larry Liston in the House. In 2008, he successfully sponsored legislation to give a tax credit for companies that hire individuals with developmental disabilities. It may have been broader than developmental disabilities, may have been other disabilities as well. That bill got through. It was a very modest tax credit, and I think it probably has expired. But perhaps that's something that could be looked at again. I mean, I don't want to get up here and debate Tabor. That's not why we're here tonight. But Tabor, right now, we are refunding lots of money to citizens. Having additional tax credits won't take money out of the wait list or education or something. So again, maybe something that could be looked at.
And the other one that you're mentioning, yes, recent bills, the other one is getting rid of sub-minimum wage. So that's something that happened relatively recently. And I think, again, is just, really validating and showing the importance of allowing people to work and receive, a paid wage that is commensurate of their time and effort and what they should be paid. So that's another important one. So I think there's, chipping away at it.
Yeah. This relates to something we just talked about. I'm just going to read it forever to make sure the panelists hear this. As far as increased trainings for our police force and the disability community, is there a way that stakeholders can be involved? It would be helpful and beneficial to learn from people who live in this community every day. So I'm not going to throw that out just to make sure everyone hears it. This one is a little different, and then we'll go to the audience after this to see if we, what can the state do to support older adults who transition from Medicaid to Medicare and no longer have non-emergent medical transportation? Don't know if that's also back at HCPF. Currently, we have such a growing older population. We're one of the fastest states in terms of the share of people who are moving into the 65 plus category. Mayor and then Sally.
So Councilmember Avila and I actually are on a team that alternates back and forth between Fountain and Colorado Springs, being in charge of it every year. It's a federal issue. We have a great partnership with not only Fountain Transit, which Rosa over there works with, but also Lan over here with Mountain Metro, the new director over there. And then we have PPACG in the house that deals with all that kind of transportation. So if you guys could raise your hands so that when the meeting's over, people can kind of talk to you about transportation issues. I'm super excited about some of the things we're doing right now. The doors are open. Don't you agree, Yolanda, to some of the conversations we're having and ideas we're throwing out and some of the changes that we know need to happen? I don't want to give you ideas because then you'll get excited and think they're going to go in and do it. Actually, Laura is here tonight because we are working on a long-range transportation plan. And one of the things within that plan is specialized transit, which a lot of us use. And we are looking for participants that use the services or have family members that use the services, a variety of ages. Because if you're 65 and under and you're disabled, you can use those services, and also seniors. So Laura or Lon would be your people over there to sign up to get on that committee and be actively working on that plan that is going to be completed this year.
Sally?
So I was going to see if you have a microphone, if you could give it to, we have a couple folks here from Mountain Metro. Lon and Jacob are here. Also wanted to point out Rob Hernandez is right here. He's our ADA coordinator for the city. And then also in the audience, we have Paul Morrow from our housing community development. Just raise your hand. So do you want to take that?
Maybe,
Is that
maybe in
something?
20 minutes when we have the break, people
Okay.
can talk to them. But that's a great idea.
I'm just saying, I
Yeah.
don't have necessarily all the
Yeah.
answers, but that's why
Yeah.
we have the professionals in the audience.
Okay. Oh, okay. I recognize your
I
handwriting.
love it,
Yes.
Laura. So Laura is looking for people for her committee, and I apologize for using an acronym. PPACG is Pikes Peak Area Council of Governments. It is a intergovernmental body of people from 3 counties and 16 different municipalities that we work together. And one of our main issues we work on is transportation and senior issues. That is your area on aging place. And since there isn't anybody else here from that tonight, Laura can handle that one too.
I know services for seniors is a big priority. There are 16 area agencies for aging around the state, and there is a big push this year to get more funding. The funding has been flat for a few years, so the area agencies on aging have already been hounding the JBC members about that. Questions in the audience? Yes, we have the microphone. Go ahead. We've got you. Yes.
Oh, okay. Sorry.
Come on down.
All right. My name is Heather Cluck. I serve on the board for the Pikes Peak region. And I wanted to address possible availability for autism signs being put up around schools, ABA centers, and even as tiny as just streets.
Autism signs?
Yes. I've seen them in other cities. They come in with multiple phrases like autistic child area, autism area, autistic child at play, things like that. And I had reached out to the city via the Go COS app and was told that the only sign available was a blind child area sign. And they were trying to get me to, apply for one of those. However, that does not fit the need for persons with autism. And I personally live on a street where there are like 3 or 4 different children with either autism or IDD.
That is not a question I have heard asked in all the years I've been doing this. So a question for probably our city government folks, could you have a sign in front of a school or a home or a neighborhood that says autism child or autistic child, just so that drivers would know that it's a child with those issues that you need to be vigilant of as you drive by? Councilwoman.
I think that's a great question and a great solution. So it's nice when people come to us with solutions, but Rob Hernandez is your man. So get a hold of him, and I think he can make things happen. He came to the city a couple of years ago, and wow, did he transform things. So he's a man that knows what to do.
So that's a great question and a great answer. In Colorado Springs, talk to Rob Hernandez. Mayor?
I will say one thing. If the signs occur, and I'm not saying they would, right? But if they would occur and if there became a policy, if you move, we need you to contact the city. I know we have signs around our city that the people no longer live there, but nobody's formally notified us, so we can't, the sign is still there.
Yeah. Good
So
point.
that would be a really good thing that people could help with.
Yes. Representative English, or Representative Vihel, sorry.
Yeah.
I'm looking at you talking to her. Yes.
No worries. I love that idea, and I want to mention something that's going to come up next year that I think is relevant for our local government leaders as well. We'll have a bill coming up in the legislature next year to create a grant program specifically for vulnerable road user protection projects. So that will include things like signage, but especially like traffic calming, design changes that relax traffic, that keep pedestrians more visible and more safe, and that includes children at play and especially children with unique needs. So I just want to put a plug that exists and that it's coming. And I think that'll be a great way too for the state to partner with our local governments to incentivize just safer traffic for everyone.
Thank you. I think we're going to keep moving just to make sure we get more audience questions.
Hi, I'm Rachel Collins. I'm Gavin Collins' sister. I've actually emailed multiple of you about my brother. He is now 20. He's level 6 on the DD waiver. Back in June, we went to the Security Public Library. He had a difficulty leaving the library, and the cops were called. They did not bring a mental health clinician like I asked. They put him in handcuffs and then forced us to take him to the hospital. We cannot get any day program. He's considered a one-on-one. They keep telling me staff shortages, but it seems like they're gearing toward more people who don't need the one-on-one. And my question is, what would really help is if the city can create a community center that includes stuff like a track, indoor swings. Just because he's 20, he still likes to be on the swings all the time. So I was just wondering if that was possible.
And did you say you were from the City of Security?
No, I'm just his sister and caregiver.
Okay. So this is really for any city. Can we have more city centers for people to go to since his needs are not being met currently?
I guess I would just say that I would love there to be more centers like that. And I think that our biggest challenge, and no one will like hearing this, none of us like it either, the challenge of staffing such a place. But that doesn't mean that we can't continue to talk about that. And I agree with you that that's something that we as a city need to work on. So I really appreciate you asking.
Yeah. Back to transportation. When will we have free bus fare for people with disabilities? Council member.
Okay.
Avila.
You know what? We've come a long way, baby. I returned to my beloved hometown in 2011. Buses were running Monday through Friday, done at 5:30, and that was it. And then a group of us organizing for transit, worked on it for like 3 years, and we got it to be 7 days a week and evenings. And so we keep progressing in that area. So I'm just going to say though, we had because of the state and Governor Polis having free fare for better air, right? And when you do things for people with disabilities, right, it just makes things better for everybody, whether it's the ramps, having public transportation. And so you could talk to Lan over there, but we knocked it through the roof. We had so many people using public transit, and it's really worked. But I'm going to tell you, one of the disappointing things is that it was brought up initially for the clerk and recorders that he wanted to have free fare for better air on Election Day. And that, we're so autocentric still, that was killed. And the mayor was behind it. We wanted it. Most of us on city council, and for whatever reason, that was killed. Where we could have a free fare for Election Day, for us to be able to have to go and vote that day. And some people on elections, they say, well, they shouldn't wait till Election Day. And I know a lot of people that love to vote on Election Day because they feel the privilege and the patriotism, and there are a lot of people that do that. I'm too scared to do that, actually. I do it early. But so we've come a long way, but there's still a feeling of, that there's not really that need for public transportation. And it's a constant battle, but as we grow, and if we want to keep millennials here and Gen Zs, we better get on the ball and increase that. But we have increased ridership. We have increased frequency. We have increased routes. And I'm really proud of that. And yes, we still have a long way to go. But does that answer your question?
Do we have a microphone for that half of the room? I don't want to ignore that half.
While they're walking, can I just?
Yes, while they're walking.
While they're
yes.
walking, I'll just be really quick. I want to point out we have 2 bus systems in El Paso County. We have Mountain Metro, which serves Colorado Springs and Manitou. Is that it? And then Fountain has their own bus service. So I want to make sure if you live within the city of Fountain, you can email Rosa or myself with suggestions about the Fountain transportation. And we have since we're a much smaller bus system, we're a little bit more flexible and what we can do in terms of changing routes and things like that for people. But I just want to make sure people understand that. So don't contact Mountain Metro if you live in Fountain because she can't help you.
Okay. One question over here, then I want to make sure we get to that side of the room. Go ahead.
Is providing for mental health for the disabled. I am glad that our police are being better educated. I'm happy to hear that we have crisis units. I'm glad that Medicaid is pouring more money into that. But when we end up in a real crisis that requires inpatient hospitalization, there is a barrier for both the intellectually disabled based on their IQ, and there is a barrier to services based on their ability to do all of their activities of daily living. So if we have a disabled individual that is intellectually disabled and cannot do all their ADLs, mental health facilities can deny them admission even if they are in crisis. What are we doing to serve that population rather than leave them at the mercy of our hospitals or their providers?
So individuals with developmental disabilities are being excluded from mental health facilities and remain in hospitals. How do we make sure they can get access to these important services? Not an easy answer. I don't see a lot of hands going up. And that, I mean, it's understandable, but it's a very tough thing. Anybody want to offer something? Representative Snyder.
Well, thank you. That's a great question. I can only borrow from some of the other programs that were launched last year. So we have the intervener program for deafblind children, which really brings somebody trained and skilled in order to help them navigate through the difficulties. It sounds like many times this might even be a communication issue where they can't really screen the person and make a determination. So I'm just wondering if some type of specialized intervener would be helpful. I see you have your hand up.
Yeah. Maybe afterwards you can follow up with that. I want to get to a question over here, and then you've had your hand up, but one over here first, and then we'll get to you, sir. Yes.
My name's Mike Madej. I have a mediation practice in Colorado Springs, and I've worked with mediation in this community for, gosh, the last 30 plus years. I helped start the Colorado Office Dispute Resolution Program, which is a court-connected mediation program with our courts here. And I don't really have a question. I have a thank you for members of the legislature present for House Bill 1123, which you passed last session, which requires mediation in cases where people with that receive SSI, SSDI, or TANF are being evicted from their housing. Obviously, the way to prevent housing is to preserve housing for people that do have it as much as possible. And what we've been able to do, the program started, I think the governor signed it in June. It started July 1st. We've been scrambling a bit to get caught up, but it's opened up an opportunity for folks with disabilities to either stay in the housing that they're in or to transition into other housing in a way that makes them not homeless. So just thanks for that.
Thank you so much for recognizing that, sir.
And also, especially Rep. Snyder, we had a couple of long conversations about that bill. And Mark, I appreciate your help with that. Made it a better bill.
Thank you, sir. Yes, sir. You've been very patient here. I appreciate it.
Good evening. My name is Jesse Torres.
This is my wife, Sarah Torres. We are parents of an adult disabled child. Our child has had a mental and other learning disabilities. My question is directed to basically, and I don't know if this is the right forum, but we fly out of Colorado Springs an average of 4 times a year. And as a disabled people, we have very, very hard time. Under the Air Carriers Access Act, we have rights as disabled people. And under this act, the rights are being administered properly when we in-plane or when we access the carrier. We are given first priority and everything else. As disabled people, we normally sit at the front of the airplane. And my question and my concern is regarding deplaning. I have had where we stand up, people, and everybody wants to get off the plane, rush off the plane. We're trying to get into our wheelchairs. We're trying to get into to access the ramp, and we're being shoved, pushed, and we're being, basically issued profane language to get out of the way, and so on and so forth. Under the Air Carrier Act, it says one of the requirements, the Secretary of Transportation can formulate and is required and should formulate standards to address effective boarding and deplaning. My question is, who is going to take this action to get regulations for deplaning? It seems like there should be some regulations where the public has to wait, as they do when we board, to let the people with disabilities, to let the people who need to get to wheelchair access, to get those appropriate services and not to be shoved, pushed, and to use profane language against.
Okay, thank you for your question. Does the city have any ability to work with airlines? I mean, in many ways, that sounds like an airline issue. Obviously, federal law, but it's the airlines, and I don't know, Commissioner Vanderwerf and Mayor?
Yes, we don't really have a relationship with the airlines to do that in the county, but I would like to point out a private nonprofit that I'm aware of. It's called Angel Flight West. Also, it's just known as Angel Flight, and they fly people with disabilities for things like medical treatments, and they fly cancer patients for treatment.
So a related issue.
But they, I happen to be a pilot, and I fly these missions for Angel Flight West. I'm also happen to be the Colorado wing leader for Angel Flight West, and I have flown people with disabilities on missions. So that, notwithstanding, I can't answer the
specific question about the carriers.
But there is another service available for people with disabilities, and that's Angel Flight West that you could possibly use.
Good information. Mayor?
A few years ago, when our water became contaminated in Fountain by PFAS, the city of Fountain was really fighting to get to the right connections we needed, and our state representative at the time, Lois Landgraf, stepped forward. Using her influence as a state representative, she was able to get us access to the meetings we needed with our federal representatives and senators, and I think that might be a possibility. So you can look at your voter registration and figure out what House district you live in, and potentially your House representative or state representative can help you make those contacts with the federal representatives for that.
Very good point. Sally, yes.
Yeah, I was just going to say that I can talk to Rob and I can chat afterwards. You bring up a really good point. The city does have our airport that is, it's an enterprise, but it is still under the city of Colorado Springs in terms of our local regional airport, and we'll see if we can get some answers to that. So if you'll make sure that we get your contact information, we'll follow up with you. But thank you for bringing that up.
Thank you. And again, back to the state level representatives, sometimes something like this, just a letter from the state representatives to the airlines that serve Colorado Springs, lets them know that the issue has come up and they're kind of watching them. So that can be done. I'm just going to read this question, then we'll go to the audience again. How can we make transportation more accessible? For example, people with large strollers are unable to ride public transportation or are only allowed to carry on 2 grocery bags. Again, I don't want an answer. I want to keep moving, but just to raise it for everybody. Yes, another question from the audience.
Hi, my name is Steve. I'm a UCCS student, and I'm an intern with the wonderful company of MK Legacy. And I have a question that's probably going to be in conflict with the gentleman in front of me, what he talked about just a minute ago. You talked about a bill that was just recently passed. So my concern is about housing for particularly for people with IDD, but more broadly, this affects anyone that's on any kind of public assistance. And I think that there was some unintended consequences of that bill, because I recently spoke with a owner of several apartment complexes that used to rent to people that were on public assistance, and it became an issue when they went to go evict them. And he explained to me that their eviction policies were pretty broad, pretty narrow. I mean, and it takes a lot to get kicked out of one of these places, Murray Street. But
So perhaps the two of you could chat, and certainly that's not unusual for a bill to pass and it needs to be modified. I mean, I don't want to say that's why they need lobbyists, but in some ways, bills are passed and they may not be implemented properly, or it may need to be modified.
I just know that it limits the availability of housing for people who are in need.
Okay. Thank you for that comment. We are at our closing hour. What I would like to suggest is, I didn't get a chance to read all of these questions. I will volunteer, provided the penmanship is legible, to type up the questions, send them to Colleen, and then we will distribute them to everybody, just to make sure everyone's aware of what's being raised. I will volunteer to do this during the next Broncos game, because I won't be watching that. But now we have an opportunity to have people talk on an informal basis, and that will be right here. So I'd like to have a round of applause for all of our elected officials on the panel and our guests. And our elected officials who chose to sit in the audience and just learn. And that's a wonderful thing to do as well. So thank you for that. These are great organizations that sponsor this. We had, 100 people online, a whole bunch of people in the audience, and I think people learned a lot. So thank you, and our guests will stay here. If you'd like to come up and have further discussions, specific discussions, please do so. Thank you so much.